Hello everyone. So we have a 34-year-old woman who come to emergency room because of right lower leg swelling, redness and pain. Well, she has a history. Her mother has a history of pulmonary embolism. Vitals are normal and examination shows tenderness on palpation to the right calf. Compressive ultrasonography shows a deep vein thrombosis of the right leg. Well, she has elevated plasma homocysteine level. She started on heparin and warfarin therapy. Now, what other additional therapy is indicated in this particular patient? The answer is pyridoxine is indicated. Why this? Let's learn in more detail. The patient has deep vein thrombosis in the setting of increased homocysteine levels. Homocysteine is a highly reactive amino acid. And the increased level predisposed to venous thrombosis as well as atherosclerosis. That means dangerous for both arterial and venous system. And this due to a combination of, it can cause direct vascular damage, both artery and vein. It can activate clotting mechanism also, and inhibition of antithrombotic pathway. It means you can say it's a type of increased level, it is a type of prothrombotic. So the patient DBT treatment should include attempt to correct her homocysteine level. Now let's read more basic concept about homocysteine. Without understanding of the basic, you will not understand why the answer is B6. Homocysteine can be metabolized to cysteine or methylated to form methionine. So these are the two end products that can happen from homocysteine. In either of these pathways disrupted by enzyme or cofactor deficiency, the homocysteine level will be elevated. Well, homocysteine to cysteine pathway is catalyzed by cystathionine Beta-synthase. In short, we write CBS, and the cofactor is B6. So now, and homocysteine to methionine pathway is catabolized by methyltransferase, methylenetetrahydrofolate, reductase, and methionine synthase with folate and cobalamin as essential cofactors. Okay. Well, if you look into same, this homocysteine getting converted into cysteine and we need B6, and homocysteine getting converted into methionine, we need B12 and folic acid. Okay. So B6 and B12 and folic acid. Now, independent of underlying cause, homocysteine level can underline be normalized by addition of B6 and folate. B12 should be added if B12 deficiency documented. B12 treatment will correct homocysteine level. Okay, so now we can see there is the role of B6 and B12. Well, so we need these, any of these. If you look into the options, now other options, clopidogrel, they inhibit platelet aggregation. Now, what's the mechanism of action of these drugs? Stop the video, write down the answer of this question. How these two drugs are going to act. They block ADP receptor on platelet. So they are antiplatelet, but they have nothing to do with homocysteine metabolism. So this option ruled out. Clopidogrel is used in the treatment of arterial thrombosis like MI stroke, but not used in the treatment of venous thrombosis. Vitamin E is an antioxidant act to protect cell membrane from free radical damage. It has got no effect on homocysteine metabolism, so it is not the right answer. But again, I have a question for you. Stop the video, write down the answer. What are the important effects of vitamin E deficiency? Various, whatever, in the whole body. They can disturb spinocerebellar. The vitamin E deficiency can lead to ataxic gait. They can also lead to posterior column dysfunction, which can lead to loss of position vibration sensation. Peripheral neuropathy can lead to areflexia. It can lead to ophthalmoplegia, skeletal myopathy, pigmented retinopathy. It can lead to hemolytic anemia, acanthocytosis, and thrombocytosis. So you can see there is involvement of the neurology in the blood also, in the muscles also. Let's look into other option. Ethione is used in oral contraceptive pills and hormone replacement therapy. And there's an increased risk of thromboembolism. And moreover, it is not going to reduce homocysteine level. So this option is totally ruled out. Simvastatin reduces LDL. It is HMG coenzyme A reductase. It is not used in the treatment of deep vein thrombosis. The golden line to remember, B6, folic acid and B12 are involved in the metabolism of homocysteine. B6 lower homocysteine level by acting as a cofactor for enzyme cystathionine beta-synthase, which metabolizes homocysteine to cystathionine. Homocysteine to methionine pathway is catalyzed by methylene tetrahydrofolate reductase and methionine synthase. For this, we need folate and B12 and essential cofactors. Okay. Thank you very much.